Well, hi, everyone, and welcome to the MGMA Podcast Network. I'm your host, Daniel Williams. I'm a senior editor at MGMA and so glad to be here with you today. What we're going to be doing here today is talking to one of our speakers at our Leaders Conference that's going to be coming up in Orlando, September 28th through October 1st is when the conference is. It's going to be in the the happiest place on earth there at Disney. We're not going to be physically at Disney, but we're going to be right around the corner, and I expect many of our speakers and guests will probably stop by. So today we have Rana McSpadden. She is going to be one of those speakers at our show, and she is a consultant with the Medical Practice Services Department at SVMIC. And Rana, we were moving heaven and earth here, trying to get connected today. Sometimes technology is so amazing, and sometimes it just kind of impedes us from communicating. We even made a joke that we were ready to get the Dixie cups and strings out if we had to. So, Rana, welcome to the show.
Thank you so much. And I think it's really fitting that we had so much technology issues and we're sitting here talking today about cybersecurity.
Exactly. That's a great point. So bring us up to speed then. I talked to so many people from your organization. Are you located where, in Tennessee, or are you somewhere else?
I am in Tennessee, but I am not out of our Brentwood office. I am one of our remote employees.
Oh, okay. Where do you call in from?
Difficult, Tennessee.
Are you pulling my leg here?
I'm not pulling your leg. No. If you can Google Difficult, Tennessee, and it's a small little sleepy community, but we're here.
That is so remarkable. With a name like that, how did it get its origin? Certainly y'all all know this, right? Or do you have any idea how the town got that name?
So the legend goes that when they were trying to name the area, the community kept coming up with different names and sending them into the post office so that we could get our zip code. And the post office kept saying, oh no, there's already a town in Tennessee with that name. There's another town with that name. So somebody wrote on there, this is difficult, and capitalized the D. And so the post office said, yeah, that's about right. So Difficult, Tennessee.
I know the state a little bit, so I know where Brentwood is. Where is Difficult in relation to Brentwood, which is a suburb of Nashville, right? Or a part of Nashville?
It is, yes,
yeah.
A suburb of Nashville. I am about an hour and a half northeast of Nashville. So,
okay. So are you in the Smokies, or where?
No, I'm not that
far east. Okay.
No, I'm still in Middle Tennessee.
Okay.
But I'm still in, pretty much rural areas.
Yeah. Well, when you get a name like Difficult, it's not it's not like Manhattan or something. So I figured it might be a rural community. So even more important to really be talking about cybersecurity and the kind of services that might be available to people. And even though I'm in Denver and you're in Difficult, Tennessee, we had a heck of a time getting connected today. So, Rana, it is so cool to get to talk to you. So let's go a little bit into your background then. What brought you into the healthcare world in the first place? What was that little spark that got you there? Tell us about that.
Well, I kind of fell into it, actually. So back when I was in high school, my then boyfriend, now husband's mother, she ran a radiology billing company, and they were in the process of changing billing systems, and they just needed some data entry people. So I went in, started working for them. It was supposed to be temporary. And here I am, 20-some-odd plus years later, still in healthcare, and enjoying every minute of it from this perspective.
That's so cool. So I know that SVMIC does a lot of things. So what is your role there? How would you define that to our audience?
So I'm one of the medical practice consultants. So with SVMIC, we are a professional liability provider for our policyholders. And one of the benefits to being a policyholder of our company is they have access to our consulting services, and our consulting services are value added. So they can call in with all kinds of questions about billing and coding, HIPAA, OSHA. I'm working really, really hard. I'm not making any money. I'm barely making it. What's going on? I'm needing help with contracting my insurance companies. I'm needing some help with credentialing. So they can call in and get our services value added to their policy.
Okay. Now, you're going to be talking about cybersecurity. You already mentioned that at our Leaders Conference. We'll get to that, but let's just talk about cybersecurity in some of the philosophy or ideas you have around it. I have some notes here that a lot of people think it falls squarely with an IT department. You have a different approach there. Talk about all the people that are involved with it, the stakeholders, et cetera.
Sure. So when you go to a lot of conferences and you talk to somebody that's talking about cybersecurity, they're from the networking side, they're from the computer side of it. And I'll be honest, I have no idea anything about networking. I am not a networker when it comes to computers. Right. But I come from the business side of it and what the practice needs to be thinking about as a whole, because really cybersecurity is a whole system. It's all the staff, it's leadership, it's the physicians, of course, IT too. Everybody has to work together in order to ensure that they are doing their part to secure the electronic data of their patients.
Okay. I'll tell you, in real time, this is such an important topic to everybody that works anywhere, because there's all those different aspects of how people try to get into, somebody's network. At MGMA, our IT team sent out something to us today, and because there's some phishing scam that's going out, and they showed us a picture of it. They said, do not click on this. So when you think about cybersecurity, what are some of the common threats that you're seeing out there? What would you like to share with our audience about that?
Well, of course, ransomware is really one of the biggest threats, and that's one that we always hear about. But the real threat is how they access our systems in order to launch that ransomware. And generally, it's through weaknesses in our systems and general just phishing emails, phishing phone calls, phishing texts, trying to gain access using our credentials. They trick us by sending us a link saying, hey, click here. We need you to log into your cloud system because your password's about to expire. Yep. That's the big one that catches a lot of individuals. Here at SVMIC, they actually, our IT department actually will phish us to test to see, are we paying attention? And one of the phishing tests that actually caught a lot of us was, it looked like it was coming from one of our policyholders. Yep. Saying, hey, I need you to click on this link to see what's going on. And it caught a lot of our employees. So they're getting really sophisticated with these phishing emails. We are no longer in the days of broken English and misspelled words and all that kind of stuff. They're using AI to write these things. They're even using AI to, they trick somebody when they call in, make them think that it's somebody that they know or somebody that they work with. Right now, I'm actually even hearing, we've actually had 2 instances where physicians have fallen for a phone phishing scam where the threat actors pretended to be DEA agents. The creativity of these threat actors is amazing. Yeah. I can't, you just can't keep up with them. That's the problem. Everything's changing so quickly and so often. There's no way to truly keep up with everything that's coming down the pipeline.
You make so many good points here, and there's so many things I want to follow up with. I'll just share a couple of them. It's the evolution of it, the sophistication, because forever it seemed like it was, hey, I'm with the royal family in Nigeria, and it's like, okay, that maybe in the dawn of email that might have gotten somebody, but at a certain point so then they're mimicking your boss, like the CEO at your company, or like, boy, I better respond to that. I don't get an email every day from my CEO, and meaning, this isn't your CEO, this is somebody else. But you brought up something else that really got my attention, and that was You didn't say just email, you said text too. And very recently, some bot somewhere has gotten my cell phone number. And so I'm getting cell phone text messages that are from the Department of Motor Vehicles, the DMV. They even got the state right. It's Colorado. That's where I am. It's the Colorado DMV. You've got something's going on. You better you ran through a toll booth or something, or we got a charge here for you that you got to respond to. And I'm going, that doesn't pass the smell test, but it's when they're infiltrating the text as well, that seems a little more personal now at this point in our lives than an email does. So what would you say to that? Because you were kind of bringing that up first. That's the more sophisticated version of how they're getting after us. So what's going on there?
Really, we have to be suspicious of everything, and just be super vigilant, because for me, if I get a text and it's from the Department of Motor Vehicles saying that I have unpaid tolls.
Right.
Well, for me, I live in a state where we don't have tolls, so that's not a big issue for me. But I got one recently from Florida. Florida. And had I been traveling through Florida, I could have easily fallen for that. But it's important to know that if you receive something like that, it feels kind of weird, whatever, don't call the phone numbers in the email or the text or whatever. Go online, find those phone numbers, and then call them directly. Okay. But the DMV, DEA, all government agencies, they're not going to call you and say, hey, you've got unpaid fines. You've got, you didn't show up to jury duty. And now you got to pay a whole bunch of money. The DEA is not going to call you and say your license, DEA number has been used across state lines, and now we're going to come for you if you don't pay these penalties or help us, whatever. You have to go with gut feelings, unfortunately. Right. And sometimes it's hard to know exactly when, but if something doesn't quite feel right, I always just ignore that source and go to the direct source.
Mm-hmm. You use that term vigilance. So we were talking about it in a lot of cases from an individual perspective as a person. But when you're an individual who is representing a medical practice, I'm sure some of the best practices still are at play here. But are you seeing trends then that a medical practice may see, so we can alert our listeners here, things that they should be thinking about that are prevalent?
Unfortunately, I'm not getting a whole lot of those calls from our policyholders. Okay. I hear a lot of the aftermath of what happens. They've been hit with ransomware, and part of if you're a policyholder through us, we do provide a certain level of cyber liability insurance. So when those calls come in, they go straight to that's insurance company for them to handle, because we are kind of hands off with that. We don't want to be the ones really telling them what to do from that point, because we're not the experts. Yeah. We're going to pay the experts. But really, it's the biggest thing that I'm hearing. So really is just just checking flagging emails. Really, that's where they're coming from, or system weaknesses, where I'm hearing actually a lot, especially with some of these smaller groups. They don't have the funds of some of these larger groups to be able to pay for large and expensive firewall systems. So their systems are weak, and and so hackers are able to access their systems through unpatched security systems, through websites, because they may have open sourcing in that. So the biggest thing is do what you can to close off those systems, getting vulnerability scans, getting penetration testing, because those are white hat hackers that are professionals that are going to hack into your system to see where your weaknesses are. The biggest thing is do what you can to protect yourself, and then train your staff.
Yeah, you are going to be talking, as we mentioned earlier, at that Leaders Conference in Orlando. You're going to be talking about creating a culture of cybersecurity? You were getting to it a little bit there about getting into helping the teams and everything, but what does an overall culture of cybersecurity look like in an organization?
Well, with any culture, it's in the bones of the practice and the entity. It's part of your mission. It's part of your values. And really to develop that culture, if you want your staff to do something, the leadership has to head that charge. They're the ones who have to show, I take this seriously and you should too. Actually, a perfect example, several years ago, I was at one of the MGMA conferences, I believe. Where were we? We were in Vegas. And my CEO actually had gone to that meeting with us, and he sat next to me in a cybersecurity presentation, and I was sitting there watching him just turn white because at that point he hadn't really thought about cybersecurity. So he came home from that meeting and immediately made sure that our IT department was implementing all kinds of cybersecurity education and going well into making sure that there's no way that somebody can hack into our systems, and teaching our staff members what to watch for with phishing, giving them ways to notify, hey, I've got an email I'm not sure about. Can you take a look at it? And so it was definitely a top-down mentality. He started that we have to do this. And so it just infiltrated into the company. And that's really what any practice needs to do. They need to have everybody involved needs to know and show the seriousness of cybersecurity so that staff understand their role in the cybersecurity of the practice as well, and that they feel like they have a responsibility too.
Right. Now, in researching you and looking at your background, you've also worked with compliance topics like HIPAA and OSHA. So when we think in terms of cybersecurity, how are those other compliance topics similar? How are they different? How would you describe that?
Yeah, it's just another piece into the compliance puzzle. And actually, with cybersecurity, it is a requirement under the HIPAA security rules. So, it's kind of tucked in under HIPAA, but it should also be a piece of its own. And it's become such a huge thing that several government agencies have produced multiple cybersecurity tools for entities to use. HHS actually has a voluntary program out there right now for cybersecurity to bolster healthcare security.
Okay. Got a couple more questions for you before we sign off then. For people who are interested in your topic and are planning to be in Orlando, what's something they can expect from that presentation? What's something they can take away from it?
I'm hoping to show that the importance of that, how important it is to take this seriously. And a lot of smaller groups, they feel like they don't have the resources available, and they may not have the money available, but there are still things that they can do to protect their systems. And my goal is to not really talk about the types of threats that are out there. It's really more about how to recover, prevent and recover from those events. Because we're in a day and age now, it's no longer if something's going to happen, it's when it's going to happen. So it's best to already have a plan in place so that when something does happen, and hopefully it's something small, you're not trying to you're sitting there with scratching your head trying to figure out what to do next. You already have at least a basic plan in place that you can then adapt from for any nuances that come through.
Okay. We're still several months out from that Leaders Conference. So what are some things that our listeners right now can do today? Maybe taking a step or a couple of things they can do to protect themselves.
One of the first things that I want to recommend is that they look at their security risk analysis, make sure it has been updated recently and often. HHS and the OCR, they are cracking down right now. With earlier this year, they launched a risk analysis initiative, and they're imposing penalties, and they're penalizing entities that suffer breaches. And during the investigation process, they find that they didn't have a thorough and system-wide security risk analysis. So that's the very first thing I want to recommend is anybody do go check your security risk analysis, make sure that it is thorough and system-wide.
Okay.
Next, look at your training program. What are you educating your staff on? If you're only educating staff on general HIPAA, you're not catching the cybersecurity. So make sure you do have some sort of cybersecurity education. And in addition to cybersecurity education, have routine reminders throughout the year of, hey, don't forget, look for this kind of stuff, or this is what we're looking for, whatever's going on. Just some sort of reminder on a routine basis, and make sure you do document that kind of stuff. And then the last thing I'm going to recommend, actually a couple of other things too, but the next thing is look at your recovery plan and your response plan. Have something in place, at least, a very basic thing. And when I say recover, not only recover, but response plan is also include in there, how are we going to continue seeing our patients when and if we lose access to our electronic data? Because a lot of physicians and nurses are coming out of school and have never charted on paper charts, and they fully rely on that EHR. So having some basic education for your clinical staff on how to at least document that visit with that patient, so that you at least got continuation of that documentation in the future.
Okay.
Then I did talk about vulnerability scans earlier as well, but also look into making sure that you've got enough cyber liability insurance, that you have a open line of credit in case of an emergency, and have business interruption insurance as well, and have more than just the minimum policy limits on those as well. I have seen several physician groups that have exceeded their policy limits, and they are now having to pay out of pocket as a result of the ransomware or incident that they have, plus the following class action lawsuits brought on by the patients. Okay. So, yeah, very scary out there.
Yeah, I said that I was only going to ask you two more questions, but I thought of something else, because you are on top of this topic. This is something that's top of mind to you. What's something that's caught your interest, whether from a positive side or a negative side, that's going on in cybersecurity right now? What's a trend or something else out there that goes, whoa, let's pay attention to this?
Honestly, recently the TSA's notification about plugging your electronic devices into public-facing USB purging stations. Several years ago, I heard about that on an episode of CSI, and I just thought it was like Hollywood magic, So I never even thought about it. And now to see a government agency warning about it, I'm like, okay, that's something real that we have to watch for. So that was actually really shocking when that came out. So again, be suspicious of everything.
I think that is the theme of the day, be suspicious of everything. So that is a good example of life imitating art. I mean, you see it on a CSI episode, and there it is. So, Rana McSpadden, I just want to thank you so much for joining us today.
Thank you so much for inviting me. I really enjoyed this.
Yeah, it's been so much fun, and not difficult at all. Not difficult, no. Difficult, Tennessee. I'm going to look it up on a map, and it's just been a pleasure to talk to you.
It's been a pleasure for me as well.
All right. Well, that is going to do it for this episode, everyone. Let's just recap a couple of things here. Rana's session at the MGMA Leaders Conference in Orlando, it's called Leading the Charge, Implementing Effective Cybersecurity in Healthcare. The Leaders Conference is going to be September 28th through October 1st. Do you know what day you're talking there?
I am 8 a.m. on Monday morning. Bright
and early. You don't want to do cybersecurity like at 4 in the afternoon. Your brain might. That's where you got to do some leadership, pep you up kind of stuff. Yes. You got to be focused with that caffeine, that coffee or whatever in your system at 8 in the morning. So that's fantastic. I cannot wait to meet you in person, Rana.
I can't wait to meet you too.
All right. Well, until then, thank you everyone for being MGMA podcast listeners, and please just be suspicious of everything, y'all. So until then, thanks for listening.